For everyone that is joining now, I'm gonna be putting in a survey in the chat. If you can help us complete that, please, that'll be helpful. Thank you. Let's get started. Who wants to introduce themselves first? You want to go, Oliver?
I can go first. Yeah, sure. Thank you. Good morning, everybody. My name is Oliverio. I go by Oliver. I use they, them pronouns or he, him, anything with positive intent, really. And I am a public health outreach specialist at PACE Clinic. It's the county's HIV care clinic. And my main roles are to do outreach and also provide language from Spanish to English interpretations.
I'll go next. My name's Gonzalo. I'm he, him, his pronouns, and I'm a communicable disease investigator for the Santa Clara County Public Health Department. I work in STD HIV prevention, mostly, even though we're starting to branch out and add more diseases to our program that we follow up on. So yeah, thanks for inviting me, and I'm glad to be here.
I'll go next. Hi everyone. My name is Marcus. He, him, his. I'm a community outreach specialist for the County of Santa Clara Public Health Department. I also work in the STI HIV Prevention and Education Department, specifically in the harm reduction / needle exchange program.
Okay, do we want to move on to the topics that we have? Let's do some safe sex practices. Sexual health, Gonzalo.
Sure. So here where I work in the public health department, I work out of what we call the Crane Center. And over here we have supplies for safe sex practices, which include condoms, lube, PrEP, and PEP referrals and navigation. So we offer a wider range of different products for free. And if not for the PrEP, we also have programs that we work with. I'm sure Oliver can speak more on that, but financial assistance programs in order to be able to get PrEP and hopefully not have to pay anything. I always tell people, unless you're making like Elon Musk money, you shouldn't be needing to pay anything for PrEP. Try to make it as widely available as possible. We also offer counseling services. So if anybody ever wants to talk about some sexual health questions, they can always come over here at the Crane Center, and I'll give the whole the address and phone number and contact information a little later. But yeah, we offer wide range of services here, including testing and STI testing, STI treatment, free HIV and Hep C testing. So safe sex practices, try to use condoms. Of course, we can say that ad nauseum about condom usage. That is going to be a great barrier to preventing STIs and HIV. And if not, the next best thing is also getting tested as frequently, just normalizing that, letting that become a part of your just health checkups in general. But it's also about knowing what to test for and what you're at risk for, and advocating that, and empowering yourself with knowledge on what you may be at risk for, and advocating for yourself when you go to get checkups, health checkups, and including sexually transmitted infections such as chlamydia, gonorrhea, syphilis, HIV, as part of your normal routine testing. Making sure that you're getting the test that you're at risk for, such as, let's say that if you do perform oral sex, you have to make sure that you know that you could get chlamydia and gonorrhea of the throat if there's no barrier there, like a condom, to prevent something like that from infecting your throat. But the only way to be able to test for it is to get a throat swab specifically for chlamydia and gonorrhea. So it's about knowing what you're at risk for and what test to order. But yeah, as far as like sexual health and safety, we offer many services here: counseling, education, free condoms, free lube, which can be expensive out there. So we offer that for free here. So anyone's more than welcome to come in. And we always say, we have bags prepared with condoms and lube inside, but you're more than welcome to just go in and pick out as much as you want. So it's about, just empowering yourself on what you're at risk for, and trying to protect yourself with as many barriers as possible, including condoms, PrEP, and just testing in general.
If I can add a little bit on that, I think it's also important that that we know each other's what we know what we're getting ourselves into when practicing sex, as well as getting to know our partner or partners, because I feel that there is a lot of stigma that might be on the way when it comes to getting to know your sexual partner, or maybe us even ourselves feeling comfortable on sharing our STI history. For example, when was the last time we tested, and how many times did I expose myself, including oral sex, with someone else that maybe I might not know completely. We're the culture now in the community, especially with Grindr and other applications that make sex very accessible. The culture is very much like, okay, let's get it on and move on. And for individuals who are at high risk, I feel that it's very important to make that conversation of, oh, well, I got tested so and so, but I got myself, maybe I've had oral sex with 3 people that I might not know, therefore I don't know my status at this moment. And it's okay to be honest. That way it gives your partner the choice of how safe you want to go, depending on the type of relationship that you have with that person or with those individuals.
Yes, that's 100% true, Oliver. Thanks for bringing that up as well. And another thing that, like Oliver was mentioning, is normalizing that conversation with your partner or partners, and maybe getting tested together, and just showing, hey, look, I got my results. These are my results for this day. Can I see yours? Instead of avoiding the conversation entirely, or just taking their word for it. You may want to also, like Oliver said, just start normalizing that conversation with the partner or partners as well. So that's a very good point.
Thank you.
Yeah, because and I want to add, because it's just an overall part of sexual health. A lot of times we get lost in the definition of, what is sexual health. It's not merely the absence of disease or dysfunction or anything like that. It's a whole, it's a combination of physical, emotional, mental, and social well-being, all in relation to sexuality. So it allows the possibility of having, pleasurable and safe sexual experiences without coercion, discrimination, or violence. So it's a whole picture. And I think that was one of the questions I was asked, what is sexual health really? And that's a pretty clear definition of it. CDC follows by, and the public health department follows by.
Great. How accessible is testing in the county of Santa Clara?
So here at the Crane Center and the Public Health Department, we have our STI clinic, which we have on Mondays, Wednesdays, and I believe on Fridays as well. Hold on, no, Monday, Wednesdays, and Thursdays, sorry. And we offer low-cost STI treatment testing. The STI clinic, it's very limited on the slots though. So we have to make sure that people that are going there filling those slots are either someone that's been exposed or someone that's been tested positive for something already or having symptoms, because that's when you get to see the doctor, and it's a more comprehensive visit. But then here at the Crane Center on Tuesdays, we offer the testing for STIs, low cost, $40. It covers chlamydia, gonorrhea, syphilis, and HIV testing, and Hep C testing as well. As far as also, we offer free HIV and Hep C testing on at the Crane Center as well. So you have those options as well. And those are also on Monday, Wednesdays, and Thursdays. So it's accessible in the sense HIV and Hep C, you can drop by here Monday, Wednesdays, and Fridays and get tested on Thursday, sorry, and get tested for free. And then as far as like treatment and options, you have the STI clinic. But other than that, it's if you have a primary care provider, you can always ask can you order me STI testing or HIV tests? So it's about making sure if you have a primary care provider, if you have insurance, you can always go to a doctor and request it. You can even go to one of the urgent cares or hospitals that are around if you have pressing symptoms and need treatment right away. But we do also have our Crane Center and STI clinic here at the Public Health Department. If you don't have insurance or you feel comfortable coming to us, if we have that relationship or you want to start that relationship with us as far as for getting the STI testing and treatment with us, we're always here. I try to advocate for people to build relationships with a primary care provider that they can better get to know and have that relationship with, and just ask for STI and HIV testing whenever you feel like you may have been at risk, or if you just want to do a routine checkup. But yeah, it's if there's a way to get testing with us if all else fails. And again, I'll provide our contact information at the end, just so you can always call us and make an appointment. Or like I said, for HIV and Hep C testing, you can always just drop by Monday, Wednesdays, and Thursdays for free.
At PACE Clinic, we only provide services to people who have established care in the clinic, whether they are HIV positive or seeking PrEP services. And we are available by appointment, but also within any of the urgent care clinics at Valley Medical Center. If anyone is presenting any symptoms, especially when you know, or if they know that they've been exposed or they had a risk, they had a risky behavior with sex, and if they haven't presenting any of the symptoms, which we might talk about it later, then they can go to any urgent care, whether they have insurance or not. They have access to helping people who are not insured to apply for either medical or restricted medical, and that should cover any form of testing and treatment as well at any of the Valley Medical Center urgent care. And I believe Planned Parenthood is also available for anyone to seek services there too for testing.
It's very good. Do you have anything else to add, Marcus?
I'm done. I think everybody covered just about all our services.
Sounds good. Since we touched base on hepatitis C, could we talk more about it? Like, what is it? How do you treat it? And the options that we have. And then also there was a question from one of the participants for hepatitis B as well.
I'll start. And Marcus, you can always add on with our Hep C prevention services as well. So hepatitis C is a virus that attacks the liver. Mainly, it gets inside of the cells in your liver and starts making copies of itself to the point where eventually the cell will die and release all the new Hep C viruses that have been replicating inside and go attack the other cells. So it'll harm your liver that way, but also once your immune system sees that these liver cells called hepatocytes have been infected with the virus, they'll try to get rid of them and destroy them because they don't want the virus to replicate and make copies of itself inside and spread. So that's another way that your liver gets damaged. Throughout time, it can lead to what's called cirrhosis because of every time the liver's destroying, the cells of the liver get destroyed, it forms a little bit of scarring. And throughout the years, it can really damage the liver where it's called cirrhosis, where it's pretty much like a scarring of the liver tissue to the point where it's no longer working as it should. It can then also lead to liver cancer. So hepatitis C is something that is a virus that is now completely treatable. There is great medications out there that will completely heal you in a matter of 8 to 12 weeks, depending on what regimen you get. It used to be a lot more harsh, the medications they used to prescribe to treat hepatitis C, and it was kind of like a 50-50 chance of whether you'll get cured or not. But right now we have medications that have just been amazing and proven to be a lot less harsh on during the process of getting treated and a lot more effective. So we have just started in our program, Hep C linkage to care program, and I'll be working closely with Marcus and the NEX team to help people get into care to access these wonderful medications that I'm talking about. And whether they need help with getting linked to care, finding a provider that will treat them, or with insurance to cover for the medication. It can be quite expensive, so we definitely want to make sure that people have the access to that medication, whether it's through coverage from insurance or from financial assistance programs. So yeah, as far as Hep C, that's a little bit about it. It can be transmitted from blood. So if you have someone's blood that has Hep C infected inside, and then you have it go into your body, that's how you can get Hep C. It can also be sexually transmitted. It's a lot more rare that happens, but it can happen. And yeah, it can also be passed on from mother to baby. So Marcus, do you want to touch a little bit on what your program does as far as for Hep C prevention?
Sure. I just want to add on to that. Our linkage program tries to make it as easy and accessible as possible, low barrier. So we have a public health nurse on staff that will help walk everyone through the process, whether it's insurance or actually getting into a treatment. Specifically for my program, the harm reduction needle exchange program, we have a lot of IV drug users, substance abuse users that inject drugs. So Hep C is very prevalent amongst our participants. So we try and provide that linkage. We have fixed sites throughout the county. So we try to take the services to where the people are. You know, it's all about meeting folks where they are. So we bring those services out with us throughout the county. We have 5 different spots that we go out providing harm reduction services that include syringe services, safer sex packages, hygiene products. We do testing around the field. And one of the things I want to mention, I'm not sure we touched on, some of these tests that we do, specifically HIV and Hep C and even syphilis, these are rapid tests. So we can get these results back within 20 minutes. So we're able to perform these tests out in the field, and our participants are able to know right then and there, you know, within 20 minutes, what their status is. And from there, that's how we, you know, depending on the results, that's when we decide to go to the leakage program and get them hooked up and set up in it. So we're trying to, you know, meeting where that and nipping it as soon as possible and trying to catch it at the beginning. So like I said, the biggest thing is we try to make it as low barrier and easy accessible as possible.
And then for hepatitis B real quick, so that's also a different, it's also a virus that attacks the liver. It's mostly transmitted from body fluids, not just blood. So some even call it an STI because it's more common to get it from sex than Hep C is from sex. Um, but yeah, Hep B, there's a vaccine for Hep B, so it's not as prevalent as Hep C is, luckily. If you've ever gone to a public school in the US, you probably have been vaccinated for Hep B. But yeah, so Hep B can either be acute or chronic. You can either get it and then clear it on your own, which a lot of the time it happens, or it can be chronic where you have it, like Hep C is can be a chronic disease as well. One thing I did want to add about Hep C as well, it's like about 25% of people that have Hep C, have been infected with Hep C, are able to clear it on their own within the first 6 months. So what we do is we do the rapid Hep C antibody test to see if you've ever been infected with Hep C. And if you do test positive for the antibodies, then that blood we'll take a sample of blood and send it over to a lab to then perform the confirmatory to see if you have an active Hep C infection by looking at the viral load. And if you have a positive Hep C antibody test and no viral load, that means that you are no longer infected, but you have had it in the past. You can get it again. So just because you have antibodies for Hep C and either got it cleared by by your body or from medication, that doesn't mean you're immune to it forever. Like, you can get it again. So it's important that if you have ever tested positive for Hep C and have either cleared it or been treated for it, to make sure to continue to protect yourself and avoid a risky risk by getting either new needles if you are an IV drug user, or if you are injecting drugs. You have our program there, and you can also protect yourself by getting clean works, and we offer that as well with the NEX, and to make sure to test regularly for it.
Yeah, pretty cool. Good information. Um, can we move on to PEP and PrEP? And we can start with like what options for participants, or the difference between them two, and treatment and cost.
Yes, I can mention some information about that, since we offer these services here at PACE Clinic. Well, PEP, we don't actually. For PEP, the individual needs to be directed to the urgent care, or through, if they have a primary care provider. The PEP is post-exposure prophylaxis, and it is prescribed for individuals who they know that they've been at risk for with someone that is HIV and undetectable. And so the treatment would be to get medication before the 72-hour period since the exposure was done. And this would prevent the person who was at risk to contract HIV. It's a very effective prescription or treatment And the key here for PEP is to know that it is accessible through primary care doctor or in an urgent care or emergency room, but it has to be within those 72-hour period. And for PrEP, that is pre-exposure prophylaxis, and that is a treatment that is someone who is at high risk will take daily. In some places, they might offer injections. And it's something that is new this year. And I don't have a lot of information about that, but if anyone is interested, they can contact me and I will get the information for them right away. Just because it's new on the injection side. But the treatment for PrEP is to take 1 pill a day, and there is different medication options depending on the person's needs and exposure. And taking 1 pill a day of this medication will prevent anyone who is a high risk, as long as they follow the treatment plan or the prescription plan, which is one every single day. They would be protected from contracting HIV if they expose themselves. And let's see what other things. Anyone can get PrEP who is at risk, even if they have medical restricted or undocumented individuals can get it, can have access to it, but they do need to have that emergency medical or that restricted medical, and in order for them to receive services here. And someone can self-refer, or their primary care provider can refer them to our clinic for services.
And just to add on what Oliver was saying, as he mentioned, this is a great medication to great barrier to prevention of HIV, or a barrier to getting HIV. It doesn't protect against other STIs, so you have to keep that in mind. It's for HIV prevention. And every 3 months, when you go to refill your prescription, they will do STI testing and HIV testing as well. One more thing I wanted to add regarding PrEP is that I always tell people when they're considering whether or not to start PrEP is that one, you know your risk. You know what you like, you know what you get into. So you know your risk for HIV. I would just say the thing with PrEP is that it's not like taking just a small medication. You are taking an HIV medication and Truvada, and the most common side effects are usually stomach ailments for the first couple of weeks, because you are taking something new and your body has to get used to it sometimes. So there may be some discomfort as far as stomach aches and diarrhea. But I say this to people, you can always stop taking PrEP. If you find a monogamous partner, or you're just gonna be abstinent for a while, you can always stop taking PrEP. Now, if you do get infected with HIV, those are medications that are just as strong as they would be, even though they're great. But you can't really stop taking them. If you stop taking them, you're at risk of getting sick. So PrEP is something that you can use to protect yourself from HIV. And then once you are no longer at risk for HIV, or if you just want to stop taking it, you can. But if you do get infected with HIV, you can't really just stop taking medications without, getting sick later on. So I always tell people, you know your risk, and just think about it. It's your decision. It is a commitment. Like Oliver said, it's a pill you take every day, and you go to appointments every 3 months. But you can always stop. So.
Yeah, I think that it's really important for the individual to know what their risks are. For example, someone who has multiple partners, or someone who is frequently having sex, unprotected sex, whether that is oral or any other form of unprotected sex. with partners that they don't know, that person is high risk and will be a good candidate for PrEP. And it's important that if, say, someone who is this kind of risk, like really high, if they need to stop, they have to consult with a provider so that they can let them know when is the best time. I believe there is a specific period of time that they have to continue to take it after the last risk. So it's very important that they take this in consideration before they consider stopping the treatment.
Great. Let's talk about HIV treatment and prevention.
That will be me too. Okay, so HIV is a virus that causes immunodeficiency syndrome or AIDS. If it is not treatable, every person is different. So it takes, not everybody, for example, gets symptoms, or someone might not know that they contracted HIV. And the treatment, there is different types of medication. The treatment, what it does, it protects your cell, your CD4 cell, which is the host cell for HIV. And this is one of the immune system's cell. And the medication protects the cell as well as it blocks HIV production in the cell's nucleus from continuing to replicate the virus. With time, someone can control their HIV so that it remains dormant or controlled or undetectable. And when this happens, it means that the person cannot transmit the virus via sex to their partners. But in order for them to achieve this at this state, they have to continue. They have to stick to the treatment, which is taking the medication every single day. And recently, an injection was approved, but this one is very specific for certain populations of patients. So if anyone has more or questions or needs more information, they can contact me or talk to their medical provider so that they can be more acquainted with the treatment of injectable medication, which is once a month. And but most of the medications, I would say all of the medications, are very effective in helping individuals get to that undetectable state. And everyone will respond differently to medication. Some people don't have any side effects. Some people do have side effects for the first couple of days, couple of weeks, but eventually they would get used to the medication. And it's important that when it comes to prevention, we already talked about PrEP. We also, I think that the most important thing when it comes to preventing, whether, for example, preventing someone from the virus from being undetectable to detectable, or from someone protecting themselves against HIV, is to just be open and talk to your partner or partners. Be open to talk about sex practices, be open to talk about risk, be open to talk about testing, and be open to continue and to stick to your treatment, whether it is treatment to control HIV or treatment to cure one of the STIs, or and so. Yeah, I think I got lost on my train of thought, but I think I explained the very basic care of HIV. It is not the same for everybody, because some people might have stronger immune systems. And the important thing is to test if anyone is negative. For those that are negative, they should be testing regularly. And if anyone who's negative and is a high risk, they should really consider getting into PrEP. for the moment that they are high risk, because high risk can be only for a period of time. It could be for a few months, for a few years, but then life changes. You might get a stable partner, monogamous, or you might find partners that are very where you find trust and there is no need for the risk might decrease. And so that will be up to the person and the individual to decide whether they get treatment for prevention. So prevention for HIV is very important for us here at the clinic, and also preventing someone who's positive, HIV positive, helping them to prevent developing AIDS, which is very important to include all the aspects of health, which is physical health, mental and emotional health. And all of those services we provide here at the clinic.
And I just want to piggyback, and I think it's been mentioned a couple times different ways, but I just want to stress that HIV today is a manageable chronic illness. While you're on treatment and you stick to the regimen, it is something that you can live a full, productive life with. So I just want to stress that to everybody. It's not what it was 20 years ago. It was pretty much a death sentence back then. But today, with the medications and the treatment that we have available, it's just a manageable chronic illness.
Yes, I think anybody who has been working and with HIV, this whole misinformation thing that we're dealing with COVID now, we've been dealing with it with HIV for a long time. And like Marcus said, it's not a death sentence anymore. All we have left, the nastiest thing about it pretty much is the stigma that's left over from that era. But if I tell people it's like diabetes, like if you're diabetic, you take your metformin, your insulin, you manage it. And HIV is just something like that now. We have great medications, like Oliver said, that can help make you undetectable in a relatively short period of time. I've seen some amazing results from this. And just to go back a little bit for HIV testing, with the rapid test, just I don't think I mentioned it, but the rapid tests look for antibodies to HIV in this case. Those antibodies can take up to 3 months before they show up on the test. So you can have gotten infected last week, test negative today. And I'll go back to this when we talk a little bit about STIs. But I just want to also mention that, even if, you had sex with someone that you didn't know their status, you didn't use condoms, you're not on PrEP, come get tested. Go, that's my main thing. There's no shame in it. You don't deserve to be infected. You don't deserve to, have an infection and not get it treated. Don't look at it that way. We're all human. It happens. I'd rather you just come and get tested if that happens and feel comfortable to do that rather than be ashamed or, just wait it out at home, see if you feel anything, if any symptoms, because like Oliver said, everybody can be different as far as what they feel. Normally with HIV, the first symptom is like flu-like illness kind of symptoms because it is a virus and your body reacts to it like a viral infection at first, like a normal viral infection. So yeah, just I just wanted to mention that don't feel like we're saying, yeah, you can prevent HIV by using these tools that we have available, but even if you don't, there's no shame. You don't deserve anything that you may have gotten from that experience. We just want to make sure if something did happen, we catch it as soon as possible and we start handling it, whether it's just through curing it from medication, antibiotics, or treating it with antivirals like HIV. We want to make sure you understand that you don't deserve to have to suffer from an infection because you had a normal human moment of that. That's just what I wanted to say.
Yeah, there's a lot of stigma behind HIV that has been since the 80s, from all the things that we saw on the media and just society in general, and also depending on culture by culture, that I feel that this fear and this stigma prevents individuals from learning more about how to be safe or how to how to maintain their health once they are positive. So I think it's really important that we continue to have these conversations in the community, at our homes, and just anywhere really, to the point where we start to familiarize ourselves, especially if we are at high risk, and lose that fear. And the most important thing is to know yourself and know how much at risk you are putting yourself every time you practice sex, so that you can take the most preventative measures as possible.
That's very
There's a
good.
question that says, can you talk about the relationship between STIs, especially syphilis and HIV?
Okay, I'll take that one. Is that okay, Edgar? I don't know if we're going.
Yeah, go ahead.
Okay, so so STIs are sexually transmitted infections. So the basically each one can have its own kind of relationship with HIV. Syphilis, for example, the first most common sign of syphilis is a painless sore called a chancre. So you get the chancre wherever you came in contact with the other person's sore or chancre. So if someone has a sore on their penis and they have sex with someone, unprotected sex with someone, and that sore comes in contact with, let's say, the inside of the vagina or inside the rectum, that sore can then pass on, like the bacteria lives all on top of the sore, and it's shaped like a corkscrew. So it like latches on to the other person's skin and starts burrowing itself and making replicating itself and causing that sore. The sore is like opening a window to your body, pretty much. It's it's just saying like, anybody else want to come in, like, so if you have a sore, that's an opening to your body. And if someone has HIV and their sex fluids, it can more easily go inside. And also, whenever you have any infection such as chlamydia, gonorrhea, syphilis, your body is sending the immune system to go get, fight the infection, which then HIV is, the virus gets inside of the immune cells, the CD4 cells. So it's basically you're at higher risk because you have an infection going on which your body is actively fighting in the same area where HIV is known to most commonly be transmitted through sex. So that's one relationship. That's why having syphilis and HIV, we see that a lot because syphilis, like I said, causes an opening to your body, and then you go in with HIV that can go right in and not only has easier access to your body, but also has the cells that it likes to infect right there for it to just take advantage of. So I don't know if I answered that question or if anybody wants to add anything else on that.
No, I think you covered it, Gonzalo. Basically, the STIs increase your chances of contracting HIV. Any STI that you may have increases your chances.
So there is another question in the chat, and there was another question early on the chat, and let me go back to that one because I don't want it to just leave it hanging. So a person is asking for any agencies that there is in Oakland, California. That question might be for you, Gonzalo or Marcus, if you're familiar with.
Services in Oakland?
Yes.
Oh, I can Google them. But I believe there's Planned Parenthoods there. And I'm sure Oakland has like a public health clinics as well.
Yeah, I would look up the Alameda County Health Department and then go to their STD HIV, STI HIV prevention services, and they should have links there, and you can always call them or Google, like Oliver said.
Great. Okay, so then the next question is, can you speak about when PrEP becomes ineffective after one stops taking it? And when does it become effective again once starting again?
S- I if I don't remember, if I don't recall wrong, someone needs to continue to take the medication for at least 30 days after the last exposure, just so that the risk of contracting it from the last time becomes less or becomes zero. So that's why it's really important not to just stop taking it out of the blue. It's important that they talk to their provider. And so know that after you stop, after the person stops, they are no longer protected their cells, because what PrEP is taking one of the HIV medications every single day, just so that the cells are protected. It's the very similar thing that it does when treating HIV. It protects the cells from the virus to continue to use the cell or new cells as a host, so the virus cannot replicate. But if someone stops and they continue to have risky behavior, then there is a risk of infection right there. It becomes effective only when they take it every day. And effectively meaning like every 24 hours, and also they're not taking any other medication that the provider doesn't know, like supplements, vitamins, and other things. That's why it's very important to always be open and talk to your provider about everything that you are consuming, because some herbal supplements or some vitamins might interact with the PrEP, including with HIV treatment. So it's really important that all the medication that people are taking, including supplements, they discuss this with their provider, so that the PrEP is 100% effective. So yes, talk to your doctor and know your risk.
Yeah, that would be my recommendation, to talk to your doctor. And everybody's body is different. So, and also just to also clear up with PEP, it's also important to take it every day. So whether you're using Truvada for PrEP or PEP, you still, in order for it to be as effective as possible, you have to take one pill every day. So
Okay, very well. Can we move on to STD, STIs?
sure, I'll go with that one. So STI, sexually transmitted infections, there are several STIs out there. The most common ones are chlamydia, gonorrhea, syphilis, and you could say herpes as well. We don't usually, herpes testing isn't usually a part of the common, just routine checkups. There's two tests for herpes. There's the swabs. So when you're having an active outbreak, the provider can get a sample of the fluid inside one of the sores and send it out to the lab. That's the most the accurate way of getting a herpes test, because they're actually looking for the virus. There's two strands of herpes. There's HSV1 and HSV2. HSV1 was normally more associated with the oral herpes, HSV2 with genital herpes, but you can get either or in either site. There's no cure for herpes. There's medication to prevent outbreaks, or to, like, if you are having an outbreak, to get it passed quicker. But there's no cure for herpes. Some people never have outbreaks. Some people have one outbreak in their lifetime and that's it. Some people have outbreaks several times a year. Everybody's body is different. If you are someone that unfortunately has outbreaks often, it may be prudent to speak with your provider about it, and they can prescribe you medication, so that if you do have an outbreak, or you see the beginning of an outbreak, you can start taking the medication to calm it down. You can pass herpes on, even if you're not having an outbreak, or if your partner's not having an outbreak, they can still pass it on to you. Of course, it's more common to get it if someone is having an active outbreak and you're having unprotected sex with them. So that's herpes. We don't even really test for it, like as part of routine again, because one, there's that swab test which you need to have an outbreak for, and then the other one is a blood test that looks for the antibodies, but it's not that accurate. And honestly, I mean, if you're not having an outbreak, it's very common. They say 1 in 6 people in the US have some form of herpes. So it's just a reality that we learn to live with, unfortunately. So then that's HSV. Chlamydia is a bacterial infection. Herpes is a virus. Chlamydia is a bacteria. It's very common as well. It's easily treatable with some medication, with antibiotics. One of the most common symptoms from chlamydia is not having symptoms at all. Just because you're not having symptoms, though, doesn't mean you can't pass it on and you can't get damaged from it. The most common damage that can happen from chlamydia is if you are someone that has fallopian tubes, that the bacteria can go and infect the fallopian tubes and the uterus and cause pelvic inflammatory disease, which is an infection of the fallopian tubes and maybe the ovaries as well. So the fallopian tubes, they are like your intestines. So they use muscle contractions to move the egg from the ovary to the uterus. If they get infected, they get really swollen, inflamed. You get treated, you get the infection treated, but there's scarring of the fallopian tubes. So instead of being like this, passing on the egg, it can be like this, and the egg can get stuck in the fallopian tube and cause ectopic pregnancy. So chlamydia, it's usually either asymptomatic or with a clear discharge. And it also depends on what area you are infected. If it's your throat, you can maybe get a sore throat, but most of the time you don't know you have it. If it's in the vagina, it can, like I said, it can get a clear discharge, but a lot of times it's asymptomatic. And if it's in the rectum, it can be asymptomatic, but it can also maybe cause some discharge or bleeding. So that's something that you can look for. Then gonorrhea, it's also a bacterial infection. With gonorrhea, it's a little more severe than chlamydia usually. So there are more symptoms associated with it, more like yellowish discharge instead of a clear discharge. It's less likely to be asymptomatic. And if it's in the throat, it can lead to more of a severe sore throat, I guess you can say, than chlamydia. And in the rectum, it can lead to more discharge, bleeding, anal itching, stuff like that. If it's in the rectum, it can also like go and infect your intestines. So that's also something you need to look out for. And yeah, and the same thing with chlamydia, can lead to pelvic inflammatory disease in people that have uteruses and uteri and fallopian tubes. Syphilis is also a bacteria, and it's usually, like I said, it starts as a painless sore. The bacteria, it's a touching disease, so you get it by by touching somebody's sore, and that passes on to you. It can be usually in the mouth, in the genitals, in the rectum, because there's less protective tissue. Like your skin is different in those areas, so it's easier for the bacteria to infect in those areas. Syphilis is treated with penicillin usually, or if you're allergic to penicillin, there are antibiotics that you can take in pills. Syphilis has been around for many, many, many years, and it's on the rise again. So it's very important that people test for it often if they are sexually active with a partner that they don't know who they're active with or their status, or with multiple partners. And then syphilis, if you don't get it treated, it can cause neurosyphilis, which can go to your eyes and cause blindness, and it can cause stroke-like symptoms. And later on, it can lead to tertiary syphilis, which you can go paralyzed, and it can even kill you. So it's very important to get tested for syphilis often. And like I mentioned, the risk of HIV with these infections is high because your body's fighting these infections, and the virus, HIV virus, likes to infect those cells as well. I know we're running out of time, so I'll end it there for now.
I'm
As
not
y'all
sure
can
if
see,
I'm
there's a
not
lot of information out there about STIs and HIV.
Yeah, there's if I'm not sure if you touched HPV, the human papillomavirus, but this one is also a very tricky infection, and there is vaccine. So anyone under the age of 47, if they are a high risk, they should consider getting vaccinated against human papillomavirus.
Yes, and again, like just want to stress that there are incubation periods for these infections. So like I said in the previous example, just because you tested negative today, if you had sex with someone a couple days ago or even a week ago, you can be infected and still test negative as if you're in your incubation period. For syphilis, it could be up to 3 months. So you can be infected with syphilis and test negative for up to 3 months. So it's very important to get a regular testing if you are at risk for these things.
And Gonzalo, can you answer again, just to stress for everyone, what's the number one symptom for an STI?
No symptoms.
Thank you.
That's right. One last thing that we didn't touch on, partner support.
Yes, that's actually great. Thank you for bringing that up. So for chlamydia and gonorrhea, we offer, especially for chlamydia, we offer partner packs. So if let's say you test positive, you get the medication, but you have some partner or partners that you may have been exposed. You can ask for partner packs and they can give you extra medications to then take to your partner or partners, because you can get reinfected. That's one of the main things. One of the biggest risks for syphilis is having had syphilis before. So that you can get reinfected. So it's very important to make sure your partner or partners are tested and treated. Especially with syphilis, we say even if let's say I test positive for syphilis, I have a partner, they shouldn't just go get tested. They should get tested and treated right there and then, even if they test negative, because like I said, they could be incubating and testing negative. So we don't wait for that positive result if you've been exposed. If you do happen to test positive after, the doctor or provider may call you or want to meet to talk about a different plan after that. But it's very important to get your partner or partners tested and treated if you do test positive for an STI or HIV. We do offer partner services at the public health department. The contact tracing, which I know a lot of people now with COVID are aware of, but we do anonymous partner notification at the health department.
We also have partner notifications here at Pace Clinic.
Well, okay, it's 11 o'clock. I'm not sure if anybody has to leave now, and if there is any last questions that we can ask before we end the webinar.
Just one more plug for Get Tested SCC.org. I'll put it here on the chat. So that's our the public health department's STI HIV prevention and control. There you can find some good information, some links. We also have, I forgot to mention, you can order free HIV testing kits that you can do at home through there. There's a link at gettestedscc.org, and you just fill out a quick survey, and then you can have testing kits mailed to you discreetly for free. And it's not just like a one-time thing. You can have recurring orders. So it's free HIV testing. It's the oral swab, very easy to do. It checks for antibodies to HIV. So again, there's that up to 3-month incubation period. But you have, I think they send 4 kits to your to the address you put, and it's mailed discreetly, and yeah, it's free. I would recommend if anybody wants to have even easier access. I know I should have probably answered this when you asked about access to testing, but yeah, so this is a new program, still kind of getting used to it, but I did order some yesterday just to go and see how the process was. It's very, very simple, and yeah, we'll It's a service available if you want HIV testing. You get a test mailed at home for free. So please visit gettested.scc.org. And I'm also going to put our address and contact information for the health department and Crane Center on the chat.
Anything else we want to add, Oliver or Marcus?
My takeaway would be to just be honest with yourself and not be afraid to share with your provider, and be open to the treatment and to all the prevention measures that anyone can do, especially when putting themselves at risk. And know your partners, and just be honest and inform yourselves.
And I want to stress, as prevention services, it's all about harm reduction. So you can play as little or as much a part of that as you want. We explain a lot of ways different along the spectrum, how you can protect yourself, whether it be abstinence, barrier protection, getting tested, communication, talking to your partners. So it behooves you to take ownership and take agency of your own sexual health, like I said, and participate in it as much as possible along that spectrum. But thank you. We enjoyed doing this.
Thank you all for coming.
Thank you for making this space.
Thank you. Thank you for setting it up.
Thank you, everybody.
I think that y'all are like the smartest people I've ever met. I'm very impressed.
That's pretty sad.
I know, considering we set the bar so low.
No, that was like so much knowledge.